Good morning, guys. Good morning and welcome. And now, does anybody have any questions yet? Usually I don't give homework. Yesterday I received an email regarding that. Your homework would be just to go over the material that we have covered. Okay, guys? Okay, so I don't get assignments. Okay, there's assignment, submit that by Monday or Tuesday or whatever. Okay, guys? As far as you can say, it's preparing for this thing here. At the end of each chapter, you'll find some different exercises. If you do those, you should be more than good. Okay. So so yesterday we did cardio to a certain extent. We can just take one of the channel, for instance, or let's see cardio. Okay. We can say myocardial. L. Okay, now here L is going to be a suffix that will mainly mean pertaining to cardi is the heart. And we can say myo. And what the word myo means is muscle. Okay, so myocardial. In some cases, they may also use ec, myocardiac. Okay, so there's no real very strict rule, but it's okay in both cases. Ec or L will still mean the same. Okay, so myocardial is pertaining to the muscle of the heart. Now, a common term that most of you may have heard of. If not, well, yes, it will require myocardial infarction. Okay, that's what is commonly known as a heart attack. Okay, so a myocardial infarction is what we commonly know as a heart attack. Okay. We can take another one, and then we just proceed on to the next word. We can still say cardi. And yes.
Excuse me, is that word interaction?
No, it's infarction, my dear.
Oh, infraction.
Infarction. Okay.
Oh, infection. Thank
No, not infection. Okay,
Oh.
let me just write it for you there.
Oh, infection.
No.
Sorry, I should.
Infarction, okay? Clear?
Okay. Yeah.
Okay. If you find this, okay, have infection of the myocardium, that will become, if you find this, okay, say it. Infection of the myocardium. That will become myocarditis. Okay, that's when you actually, okay, that's when a person develops an infection that involves the myocardium, which is mainly as okay, the bulk of the heart. Okay. What this infarction here actually means is, well, okay, it's going to happen that, okay, there will be death of the myocardial tissue. That's pretty much what happens during a heart attack. That a bigger or smaller area of the heart muscle dies. Okay, dear? Okay. Whereas if you said, okay, infection, then an infection of that very same myocardium is going to be called myocarditis. Okay, where the myostil, yes, okay, is, yes, okay, the muscle, the card, and all this, yes, okay, going to be the heart. And yes, okay, the itis, which is our, yes, okay, suffix. In this case, it will mean an infection. Did you get that? Yes, no, maybe.
Yes.
Yeah.
Okay, good. Okay. Now we can say endocardium. Now the word endo actually is okay, is a word that will mean is okay on the inside. Yeah, okay. So okay. So endocardium. Now when we say yes, okay, what does that mean? That this whole word here actually is okay. It becomes a name of a structure. Okay, where do you find the structure? Yes, okay, on the inside of the heart. So that structure which is found on the inside of the heart is going to be called endocardium. Did you get that?
Yeah.
Good. Now our next word, my dear guys, is going to be cephal. Now cephal mainly as okay means head. Okay, usually it's okay when we use the word cephal and we talk about head. We talk about this head here. Okay, guys. So this will be the head that we will be referring to as okay when we say cephal. Now the first term that we may be talking about as okay when we do cephal is going to be cephalic. Okay, where okay is the ick here is okay, still is okay, our favorite. Pertaining to what? Pertaining to the cephal or pertaining to the head. Okay, guys. Now, this term here is okay, cephalic. It's commonly as okay used in terms of okay as to specify a direction, or let's say as okay location or relationship. Clear? Okay. So
Wait,
when we say
sorry, you said the ick in this is pertaining to direction.
no, that's not what I said.
Oh, okay.
The word ik mainly is okay just means pertaining to. Pertaining to what? Yes, okay, whatever your root word is.
Okay.
Okay, but when we use cephal, it's going to just okay, the suffix that will refer to is okay, that will mean pertaining to is going to be ik.
Okay.
Okay. Now the whole word cephalic is most commonly used as okay when we talk about as okay, reference to as okay, direction or location or relationship.
Okay.
Okay. Let me just give you an example. You can say, okay, if this here is okay, is the trunk of a human's body. Clear? Okay. You can say it's okay. Right, so it's okay. This here is okay, will be his or her legs. Clear? Okay. Let's just say that okay, yes, we have a neck. And on top of that neck, yes, okay, what do you have? The head. Clear? Did that make sense?
I had a question. So does that, so it means direction,
It's going to,
relationship to,
no. Okay, let me speak out. Okay, let me speak out there. Okay. So what is that we can say in this context here that the neck is cephalic to the trunk. What would that mean? That okay, as if you look at the trunk and you look at upon as okay, it's a relationship to the neck. It's towards the head. Did that make sense? So what this word cephalic mainly as okay is going to be used as is going to be as okay when we refer to things in terms of relationship of their placement. Okay. So this is more of a yes, okay, of a directional term. So, okay. Even within the trunk, you can say that okay, yes. Now, so the trunk is okay. You have, for instance, okay, the chest, and we can say it's okay. We have the abdomen. Even then, you can say that okay, yes, the chest is cephalic to the trunk. Oh, sorry, to the abdomen. Sorry.
So basically, it's whatever is above the other body
You can
part.
put it, yes, or
'Cause it
towards the
wouldn't-
head.
So the trunk wouldn't be cephalic to the neck. The neck would be cephalic to the trunk, correct?
Exactly.
Got it. Okay. So whatever's above. Okay, perfect.
You can put it that way, but above in the sense that okay, yes, towards the head.
Okay. All right, perfect.
Yeah, okay. Did that make sense? So in most instances, okay, guys, when you use the word Cephalic, it means okay, going to mean it can mean it's okay towards the head. And that's why I say that okay, this term cephalic is mostly as okay a term that is being used as a directional term. Just like you say, well, okay, yes, going towards east. Clear, okay? Or eastern. Okay, I'm on the eastern coast. I'm on the western coast. Did that make sense? Okay. Or even if you move to the Midwest, well, okay, you're still going to be in west to people on the east. Clear? Okay, so it's all a matter of okay, as many as okay going to be used to as okay pinpoint a direction of okay as where structures are located in relation to one another. Okay, so if you say, well, okay, something is closer towards the head, then that is going to be as okay referred to as more cephalic or cephalic to whatever organ or structure. Did that make sense? Okay, so it can be used for as okay establishing a relationship between location of two structures. Did that make sense? Okay.
Yeah.
But practically, yes, okay, the word cephalic, yes, okay, yes, okay, we can say okay, as it's going to be used as a directional term. It's good. It will be, you can make this okay towards the head.
I just had a question.
Hmm.
So would like your chest be cephalic to your
No,
head?
no,
Or wait,
rather opposite.
I'm trying. Oh, it would be the other way around.
Yeah.
Okay.
Okay. But your head can be cephalic because that's the point itself that you're pointing towards. Okay. So, okay, let's just look at okay, yes, our Mona Lisa here. You can go as okay from down here, but it's okay when you point towards the head. That will be cephalic. Okay. So if you say that's okay, if you start from your foot, that's okay from your feet. Anything that's going to be above your feet is going to be as okay cephalic to your foot. Because their relation to the foot is more as okay, or is closer to the head. Did that still make sense or no? Okay, so when you say it's okay, if you say it's okay, your knee and okay, it's your foot, and let's say it's okay here, you have the knee. Now it's okay, your knee, that's going to be as okay cephalic to your foot. Did that make sense? Your hip, now the hip is now cephalic to the knee. Did you get that? Yes, Dr. Justine, did you get that?
Yes.
Yes,
Ah,
thank you.
no problem. Okay. So in most instances, okay, when we use the word cephal or cephalic, okay, the word cephalic itself is okay, will mostly is okay be a term of relationship relating to the head. Between is okay, any structure, this versus this. You can say this versus this. Now, since we are at cephal, and actually it's okay, make a new word. All that's okay is going to come later on in your chapter. It's going to be in cephal. And we can say it's okay. Ik. Now here's okay, this ik is still yes okay, pertaining to. Pertaining to what? That's okay, where we become encephal. Where the word cephal still yes okay means head. But with the word in or en, actually it's okay means inside. Now a very straightforward question right now. What do you have inside your head?
The brain.
Your brain.
A brain. So the word encephal is actually as okay, another technical term that means brain. Magaz. Clear? So when you hear the word encephalic, what would that mean? Pertaining to the
Inside of the head.
brain. No. Pertaining to the brain. Okay. Now you may ask, how did they end up just okay calling the brain encephal? Think of it, guys. Many hundred years ago, if not thousands, they opened the skull of a person and they found something inside that. They say, okay, you found this thing inside the head. What are you going to call it? We call it where we found it, right? Or we call it after where we found it. That's the only reason I can think how they came up with the word encephal referring to brain. Did that make sense? Okay. So that's okay. Word-wise, that's okay. The word may mean one thing. But as a technical term, that's okay. We use it as a, like, it has a different meaning. Okay. So if you just look at the word that says, okay, in is inside, cephal is head, inside the head. Okay. That's what the word can mean. But the term encephal actually means brain. Okay. But okay, as I said, or as I just said, okay, the only reason that I can think of, okay, is how they end up calling encephalitis, okay, the brain is, well, okay, we found this thing, we gotta give it a name. Okay, so that's how it got its name as, okay, or it was named as encephal. Did you get that, Dr. Garcia? Okay, so the word may mean one thing, but the term means something else. Okay. Now, what can we have? Yes, okay, now if we say it's okay, encephal, Or encephalic will just mean it's okay, be it's okay pertaining to the brain. So this whole word here actually that's okay is just another word for brain. Now we can just put okay, yes, another suffix. Let's change the suffix ic out with something else. Okay, but it's still going to be as okay in cephal. And okay, let's just do this. Itis. So what does this now become? It can be as okay an inflammation, or a worst case scenario, yes, okay, infection. Infection of what? The brain. Clear, okay. Or inflammation of brain. In most instances, guys, okay, if you have an infection that affects the brain, it's usually as okay a bacterial infection. Okay. For inflammation, well, okay, there can be a lot of things that okay, yes, may cause inflammation of the brain, which is still going to be referred to as encephalitis. But a common thing that causes encephalitis as an inflammation of the brain is alcohol. So we'll bye-bye to your beer and red wines. Clear? So, and that's more common than you think, alcoholic encephalitis. So, okay, it's pretty rare that, okay, someone develops a infection in the brain. Okay, well, yes, okay. Alcoholic encephalitis, yes, it can happen. And if not deadly, yes, okay, it can cause severe brain damage. So, yeah. Okay. So, yes, okay, encephalitis. Now, do you guys know how the brain works? What makes the brain work? Yes.
Neurons.
Neuron, that's what makes up the brain, my dear.
Oh, chemicals,
Okay,
neurotransmitters.
neurotransmitters. Okay, good. But what those neurotransmitters, and that's why you can say it's okay. Although it's okay, chemicals or chemical substances. But what those chemical substances actually are going to do is produce an electric charge. So it's pretty much okay as chemical electrical signals, not similar electrical signals that you know from, yes, okay, from your house gadgets like, okay, the bulb, the refrigerator, the computer, the laptop, the microwave, the television, things like that. Okay, so yes, okay, even if it's your heart beating, it was electricity. Not physical electricity as we know from our power lines, but more of a chemical electricity. Clear? Okay. Likewise, the brain. Okay, now those electrical signals, yes, okay, maybe, yes, okay, causing release of neurotransmitters, or those neurotransmitters, yes, okay, at the end will lead to flow of, yes, okay, what do you call it, electrolytes, and produce, okay, an electrical signal. Okay. But guys, if we are able to, yes, okay, record the electrical signal of the heart, which we yesterday said that we call that an ECG or an EKG, you are going to be able to do the same on the brain. Okay, so what we will call that? Okay, that's going to be called an elector. Here we have O as okay as our combining vowel. And now as okay, the word encephal is going to be as okay as separate, as okay a specific word. So encephal. And again, we can say it's okay, we have our combining vowel. Graph. So where is the graph? Mainly as okay, recording of what? Of the electrical or electric signals. And where do we find those? In the brain. Did you guys get that? So yes, okay, I was as a result of okay, those signals being recorded, yes, okay, what do you get as that? Okay, yes. Then we get a graph that goes like this. Something like that. Have anybody ever seen that? Not in live, but in movies and things like that. Okay.
Isn't it like where you put like stickers
They put stickers,
on your
exactly.
head? Yeah.
Okay. Now here it's okay, just the flow of electricity, there's the other way around. Okay, if the electricity of the electrical signal goes the other way around, that's when you shock the patient, right? Okay, and that's what they call ECT. E as in elephant, C as in cat, and T as in Tom. ECT. Have anybody ever heard of an ECT? That's when they shock the patient. And it's rarely been done nowadays, but it can be done. Now, why would they do it? Why would they shock a patient's brain?
Mental health treatment.
Okay.
To relive them, I'm not sure.
It's used for severe depression.
Uh,
So only people with okay severe depression is okay may get a short treatment of okay as what we call ECT. Actually stands for electroconvulsive therapy.
I have a
Okay.
question about
Yes,
that.
my dear.
Sorry, it's kind of irrelevant, but does it like, I'm gonna use funny terms for this. Like, does it like kickstart the brain to like be normal or something? Or does it like,
Well, how it works, that's okay, a long discussion, my dear.
oh, sorry. Okay.
But you can pretty much put it that way, yes.
Okay. All right. Thank you. Just curious.
Okay. So
Have
it's
you ever
okay.
seen it?
You never seen it. Well, okay, it's good.
Oh,
You
no,
haven't
I
seen it.
said have you ever seen it?
Yes. I used to work at a psychiatric unit for, I had a rotation of, okay, 9 months in 3 different departments. But where it was only one of the departments where we actually, okay, would do the electroconvulsive therapies. But the patient would come in. So it's okay, they come in, they get sedated, and okay, as they get the shock. And the reason that they call it as okay ECT is that okay as they get shocked, they actually is okay go into what looks like a epileptic fit. If anybody know what that is, but
Like a seizure?
yeah, pretty much. Okay, but for a very very short while. But we had to have okay that anti-epileptic medication ready. That okay, God forbid that okay as the epileptic fit. Okay, you guys says okay continued. Okay, that they may have overreacted to yes, okay, to the electrical stimulation. So that's and actually yes, okay, got into yes, okay, an epileptic seizure. But usually it's okay when they wake up. Well, okay, we'll just keep them for observation. Keep them for observation for okay, yes, maybe 24 hours. But the next day it's okay. They were good to go. So they will come in like every 2 to 3 months to yes, okay, for that therapy. But again, as like I said, it's not every depressive patient. It's only going to patients who are okay, severely depressed. Otherwise, that's okay. The rest will mainly it's okay. Try to it's okay. Treat with regular drugs and so on. Okay. So just like okay, as you can jumpstart the heart, right? Okay, a defibrillation. Likewise, that's okay. This can be jump started as well. Not jump started. That's probably a wrong term. You can say it's okay. Shocked electrically. Okay. So. Okay, guys. But it's okay when we say it's okay. Electroencephalograph. Well, okay, if you look at it, it's mainly it's okay, just an ECG of the brain. Because we just changed the word encephalograph with cardi. Well, okay, then okay, it becomes an electrocardiograph, which was an ECG or EKG. Did you guys get that? Yes, guys. Clear? Okay. Good. Now another word. And of course, it's okay. You may have okay as if and only if O as a combining vowel. Okay, and the word cerebral again is okay. Means brain. Okay, we can again say it's okay. Now we say cerebral. Now a suffix here is okay, maybe L. L meaning it's okay, will just be it's okay, meaning pertaining to. Pertaining to what? Pertaining to the brain. Okay, actually it's okay, the main bulk of your brain. The main bulk of your brain is what we will call cerebral. So the cerebrum, if that's how you want to pronounce it. Okay, which is mean as okay, just the name of the structure of your brain. And when I say it's okay, the main bulk of your brain as main is okay made up of what they call or refer to as the cerebrum. But as a matter of fact, it's okay if you look at it, it can actually, it's actually going to be divided into it's okay as cerebral. Or we actually have two cerebral. Sorry, I'm going to do this. Break it up. Hemispheres. So the main bulk of your brain, ladies and the gentlemen, is going to be made up of two cerebral hemispheres. But the word hemi just means half. Spheres, well, oh, sorry. Spheres not exactly circles. but something close to that. Okay. So actually, it's okay if you look at the brain. It may have one hemisphere, and it may have another hemisphere. So it has two hemispheres. Now we can say, okay, one is going to be, let's say, on the right side. The other one is going to be on the left side. So that's going to be as okay. But each of these is going to be referred to as a cerebral hemisphere. Okay. Any questions? Yes, ladies and gentlemen. Any questions? Or have any of you ever seen a walnut? Now, when you crack the shell of a walnut, what do you see? That your walnut actually is divided into two bulks, and they're connected in the middle. Pretty much okay, as that's how the brain looks. Okay, now if somebody wants to know what the consistency of the brain is, it's jelly-like. That's okay. Its shape, if you look at it, that's okay. Is pretty much the same as that of the nut of a walnut. Nicole, what do they call a walnut in Polish?
It's called orzeczki.
Okay, maybe we just stick with walnut.
Yeah, much easier.
Okay. Okay, guys. Okay. Well, it's okay. If you want to look or you want to see, is okay what the brain may look like. It's okay. On the outside, it's okay. It's pretty much okay like like a walnut. Okay. Or you can say it's okay, the major bulk of your brain. So that is, it's going to be called the cerebrum. Okay, but then you can go cerebral, which is just going to be pertaining to the cerebrum. And then you can say, okay, an example would be cerebral hemispheres. Hemi, mainly as okay, just means half. Sphere, not really a circle, but something which is close to being a circle. Okay. Now there's a word that, okay, that they're giving in your book. Now, guys, usually I don't like abbreviations because, okay, abbreviations can mean a lot of different things all upon us, okay, how you look at it. But anyways, sometimes that's okay. We have to use, that's okay, abbreviations. So they say, okay, let's do it this way. They will say, okay, a cerebr. Now we have O is our combining vowel. And then they go okay, sorry. Vascul. And we will just say it's okay. ER. And okay, a word which is not really a technical term is going to be as okay, an accident. So, now, guys, here's okay, the word cerebral is the brain. Vascular, mostly as okay, is related to as okay, two vessels. Which vessels? blood vessels. And AR is again, it's okay, just okay, a suffix, which is going to be pertaining to. And then accident. Okay, as I said, I don't like yes, okay, I don't like abbreviation, but it's okay, this may be abbreviated as C V E. Clear, okay, cerebrovascular accident. And that's what we commonly, as okay, on in common terms, we refer to as a stroke. Did you guys get that? Okay, so a cerebrovascular accident, or a CVR or CVA, sorry, is what people commonly refer to as a stroke. They're introducing a new term for stroke, which is a brain attack. And why is that? Because what happens to, in most instances of strokes, what happens to the brain is what happens to the heart during a heart attack. So what happened to the heart during a heart attack? Its blood flow was reduced. Blood flow to the muscle of the heart was reduced. So the heart didn't get the amount of blood that it was in need of. So it suffered. It suffered a heart attack. Of what we is okay, technically called a myocardial infarction. And now in most instances of strokes, that's what happens to the brain. That the brain does not get the amount of blood that it needs. So what would that mean? It will not be able to properly function. Or that says, okay, that area of the brain will not be able to work properly. Or it suffers. And that suffering is what you call a stroke. There are rare, not rare, it may happen that it actually is okay, is not a reduction of blood flow, but rather it's okay, a blood vessel that pops. And now you may actually have what you call a hemorrhagic stroke. You still suffer, the patient still suffers a stroke because it affects the brain. But that stroke is due to a bleeding from a popped blood vessel. Okay. So the first type is okay, is where the brain doesn't get enough blood. That's what you call an ischemic stroke. There's the other one where okay, a blood vessel pops. That's what we call a hemorrhagic stroke. But yes, okay. Most commonly, in most instances, it's okay, a stroke is due to ischemia, reduced blood supply to yes, okay, a certain area of the brain. And that's where yes, okay, people may start yes, okay, talking gibberish or whatever you call it. Not making real sense. Back home, we used to say ote bote. Okay, ote bote is okay, baby language, okay? This is okay, sounds. Or you ask them how the weather is, and they say it's okay, my shoes are tight. Or okay, I didn't ask about what how your shoes are. Okay, you may say, okay, do you know where you are? Yeah, okay. Do you mind telling me? Well, okay, milk is $23 a gallon or something. I didn't ask you the price of milk. So they may not make any sense. Now, so by SOK also SOK some neurological weaknesses as well. Okay, can't move an arm, can't move a leg, maybe SOK paralyzed on one side of the body and so on. So that's usually SOK what happens during a stroke, also known as a cerebrovascular accident. Okay, but whichever way you look at it, it's okay. Why do they call it a cerebrovascular accident? Because it's going to be the blood vessels through the brain that actually is okay. Got into okay problems. Did you guys get that?
Yeah.
Good. Now our next two words is cyst. And okay, as we may have a combining vowel, which is going to be O. Okay, but before that's okay, we go and use that's okay, the combining vowel O. Let's just say that's okay. We may have something which we call cyst. Itis. Okay. Now, guys, as I said yesterday, the word cyst, the word means or represents, okay, going to be used for a sac or a pouch-like structure. With a fluid. Okay. And be referred to as a cyst. Okay, guys. Now, in most instances, okay, the word cyst by itself, yes, okay, can also be referred to as okay, what we call the urinary bladder. And guys, when you hear the term cystitis, where cyst here is okay, is going to be as okay your urinary bladder, and the itis or itis is going to be as okay an infection. So cystitis is mean as okay, what you can call as okay a bladder infection, or a common example of okay as what people just refer to as a UTI. Okay. Now, the great majority of UTIs starts from the bladder. Okay. A great majority of your UTIs starts from the bladder. Okay, so that's cystitis, bladder infection. Okay, oh, yes, okay, you can say it's okay, beginning of a UTI, urinary tract infection. Did you guys get that?
Is this the only case where cyst would be referring to bladder if it's the word cystitis, or there's like how would we be able to tell if
Now, my dear, and that's why I say is okay, whenever you see the word cystitis and cystitis by itself,
right? So that's the only
it
time
should be
that it would be
understood.
referring to bladder.
You can say it's okay. It should be understood that okay, they're talking off
UTI or infection of the bladder.
urinary bladder infection. Clear? Okay.
Yes, thank you.
Okay. Now, my dear, what else can you get in a bladder? Cyst, which is mean yes, okay, is going to be yes, okay. Let's just say it's okay. Here we still yes, okay, say cyst is still going to be yes, okay, the urinary bladder. Okay. What we'll be doing is yes, okay, we'll be using O as okay as our combining vowel. So it becomes cysto. Clear? Okay. Okay. If somebody can get cystitis, which is okay as a bladder infection or urinary bladder infection, what else can they get in the bladder?
Can you get stones, or is that just kidneys? Like,
You can still get stones in the bladder. So what will you call that? Oh, that's okay.
I don't know. I don't know what the term is.
Okay, that's okay. No problem, my dear. That's why I'm here. But it's okay if you can get stones, right? Okay. So the term for stone is going to be lit. So cystolit. Okay, but of course, okay, that's going to be a condition. Jesus. Now, guys, cis. The word cis is okay as another common suffix that we will come across. And what that mainly is okay mean that okay, this whole word here is a process. Most likely it's okay, a process. Then we can say okay, the ear. The ear part here. Mainly as okay is condition. But you can mainly say, okay, the process of development of bladder stones will be called cystolytesis, or having bladder stones. Did you guys get that? Okay, so guys, it's not only in the kidneys where you can get stones or can develop stones. You can also, okay, develop stones in the bladder. Okay, so if you talk, for instance, okay, about kidney stones, well, okay, guys, the word lit. Sorry, guys. Because, okay, the word lit, still a stone. And we can say, okay, our iasis, yes, okay, still become, yes, okay, what we can call, yes, okay. Cis will become, yes, okay, process. And E, yes, okay, here is going to be, yes, okay, condition. Lit is still stone. But now we just, okay, yes, okay, use the word for kidney here instead. That's cyst. So that will be nephro, and of course, as okay, we have a combining vowel. That's O. So development of kidney stones is just going to be called nephrolithiasis. But the word nephro means, yes, okay, will just mean kidney. Yeah.
Hi. How do you spell the nephro?
Nephro, N-E-H-P-R. Don't worry about it, dear. We're going to come to it later. Okay. Good. So don't just a second. So the only thing that you had to change out was you change bladder out of it, kidney, the rest remain the same. So that's okay. You can have stones in the kidney. Yes.
So the suffix iasis, is that one suffix or is that two that we're using in?
While here we use it as one.
Okay.
While actually that's okay made up of 2 words.
Okay, but we're counting as just one.
Yeah.
So the one would be the process?
IASIS we can mean it as okay, the process of development.
Okay.
Okay. But what you will see later on is okay that we may use cis, your bigger or smaller sister, as a suffix. So whenever it's okay, cis is the suffix, what you actually will, or what it actually is going to do is that is going to be as okay, say, okay, this whole word here or here becomes a process. Okay. Yesterday, for instance, okay, talked about gene, right? Right? But okay, yes, when we put cis, where we said, okay, that gene or gen mainly means yes, okay, create. But then we say cis, it becomes genesis. That becomes, yes, okay, the process of creation. Did you get that, my dear?
Yeah, I get it.
Okay. So cis is off. Okay, cis is going to be as okay. Another you can say it's okay. Widely used suffix that we will come across.
Okay.
Okay. But what does that do? I mean, yes, okay, just tell if yes, okay, that whatever your root words, prefixes, and so on, so on, so. Okay. That when you ended with a suffix cis is going to be as okay, this whole new word is going to be as okay, a process. Okay, so you can say so the process of development of liver, not kidney stones, sorry, or bladder stones is going to be recalled. Nephrolithiasis is for the kidneys, cystolithiasis is for the bladder. Okay, but any term that ends with cis, S-I-S, is going to be as okay the name of a process. So cis will mean process. Okay, guys, where else can we develop stones?
Gallbladder?
Gallbladder. Here we go. My favorite.
Tonsils too.
Okay. Okay, guys. Now let's just do it this way. Okay, good. We can say cyst here is still going to, yes, okay, just be bladder. You can say it's okay. O, combining vowel. Lit is stone. IASIS, we can say it's okay, the process of development. But that was already called as okay. This here is okay, was what we mean is okay, just what I refer to as okay when we say it's okay, urinary bladder. Okay, so the word cyst is okay, mean is okay, will just mean bladder. Okay, here we is okay, we'll take it as okay, as urinary bladder. So we have to just okay, put a word here which will mean gall. And that's going to be chole. C-H-O-L-E. So the word chole actually is okay, means gall. So gallbladder stones. Or the development of gallbladder stones is going to be chole, Cystolithiasis. Clear? Okay. Did you guys get that? And just as you can develop stones, well, okay, yes, you can also develop an inflammation or infection. So that's just going to be coli, cyst, itis, inflammation of the gallbladder. What else can you develop?
Can't you get it in the mouth or like your throat?
Stones in the throat?
Yeah.
What? Not really. What they may say is okay as stones in the throat is most likely as okay if the pus of yes okay infected tonsils becomes as okay solid like okay small pebbles of stone. But
Okay.
okay, you have to be living on rocks too. Okay. Okay, guys. Now off the record, boys. Okay, just sending you guys on your short break on a good note. um, what we experienced when we experienced, okay, I remember that was during my, it's okay, gynae maternity ward where we had duties. And there was a patient who was brought in due to, yes, okay, severe vaginal bleeding. That if we asked into her period and menstruation and all that, she wouldn't say anything. Now, when they examined her, what they found was that she had, okay, it's a big perforation or a big hole in her uterus that was just bleeding. So there was no other way out than just okay to open up and operate her. Now, what they found in her uterus was okay as a piece of wood. And now, when she woke up from from the anesthesia and so on, and we asked her, "How do you explain as a piece of wood in your uterus? Anything else but as a piece of wood?" Because that becomes as a medical legal case that we have to report to the police. um, But unfortunate story was that, I guess, she had an unwanted pregnancy or something like that. No doctor wanted to perform an abortion. So she went to, work back home and call a quack. Somebody who asks, okay, I can do this. And he or she, whatever it was, actually use a stick to dislodge that embryo fetus. But doing that, just not only did he or she perforate the uterus of the lady, but also even the stick broke. And that was that remaining piece of the stick that we found in her uterus. So we said, okay, how are you going to be able to explain this? And what was her explanation? Anybody has any clue? Nope. Her explanation was that if people can develop bladder stones, why can't you develop a stick in the uterus? So we just have to like, okay, what the, okay. Well, yes, okay. But okay, she was lucky. Yes, okay, we didn't have to. Yes, okay. Lucky. We didn't have to. Yes, okay, do hysterectomy. Otherwise, yes, okay. Okay. Now, okay, I just see here. Yes, okay, okay, that they do. Okay, sorry. In your book, if you look at figure for yes, okay, 1.3, there's what they call yes, okay, a cystoscope. Okay, and again, it's okay. When we say cystoscope or cyst, oh, scope. Now the scope is just going to be as okay the tool to visually examine what the cysto, yeah, which is going to be as okay still your urinary bladder. Clear? Okay. Whereas as we said yesterday, it's okay. Using that scope is going to be scopy. So here's okay. The Y actually is okay indicate or means that this becomes a procedure. Procedure or what? We can say is okay. Using the scope to do what? To yes, okay. Visually, it's okay. Examine the urinary bladder. Did you guys get that?
So is it called a cystoscopy?
The procedure of yes, okay, using a cystoscope to look inside the bladders will be yes, okay, cystoscopy. The procedure of using the scope, right? Okay. Just like microscope was your tool, microscopy was using the tool. Telescope is your tool, telescopy is looking into that tool, right? Okay, and look at the stars. Okay. And endoscope is the tool, endoscopy is the procedure. Okay. Just like hammer is your tool, hammering is using it. Okay, and what do we hammer? What do we hammer?
Nails.
Nails.
Which nails? Fingernails?
No.
Metal
Okay.
handles? I don't know.
Okay. No, we don't hammer fingernails. We hammer as okay. Home Depot nails, right? Okay, or good. Okay, guys, now just take a short break, fresh up, refill your coffees or whatsoever. If you don't drink coffee, then get some water. If you don't drink water, then continue fasting. Okay? And I guess I see you guys back at 10:30. Is that a fair deal?
Yes.
Yeah.
Okay, guys, have fun. Okay, guys. And I guess we can just proceed. Guys, the next word that we'll be talking about is sit or site, as we may call it. A combining vowel may be as okay, O. Okay. Now what the word site will mean. It's pretty much okay as just a technical term for cell. Okay, now what a cell is, we will talk more about that in, because there's okay the next chapter. And okay, as again in anatomy and physiology. But if you guys know, yes, okay, can mean it's okay, it's gonna be yes, okay, the basic unit of life. So all yes, okay, living organisms are made up of at least one cell. Okay, so one cell is actually going to be able to, yes, okay, if it has to, yes, okay, live on its own. Okay, it may split and okay, yes, make a partner from itself. Okay, but that's going to be, yes, okay, a separate living cell, which technically is okay, can be referred to as site. Now let's just say it's okay, we do it this way and say site is cell. O is your combining vowel. And then we say it's okay, logic. Okay, which we yesterday said, okay, practice is okay, meant to know. Okay, but usually it's okay when we put it in a context to it's okay, a root word, it would be it's okay, the study of. Okay, again, it's okay, just as we had earlier an example. Cytology, now it's okay, if you look at the word, it practically would just mean, or if you look at it in that way, it just means the study of cell. Right? Okay, that's what the word may mean. But the term is going to mean something else. So cytology is mainly as okay, a technical term that they use for the unit in a clinical lab where they study specimens for cancers. Did you guys get that? Okay. Okay, because okay, what is that lab will receive? It will receive a specimen of there's okay, a tumor, a mass or something like that. But what is they will do? They will do tests on it. Most likely it's okay, check it underneath a microscope. And look for suspect looking cells, cells that may look suspect to be cancerous or it's okay, and develop into cancers. Did you guys get that? So that department in a clinical lab where they is okay, study specimens to detect cancers, or you can say it's okay, determine what kind of cancer it is that the patient had. Because okay, a tumor of the lung. Okay, you can say, okay, he or she had a lung tumor. You may say, okay, there will be lung cancer. But lung cancer is okay as just a broad term. There are going to be as okay, different subtypes of lung cancers. Okay, all dependent upon it's okay, which part of the lung tissue was it that was affected? What kind of changes was it that we had that led to the cancer and so on and so. Okay, so lung cancer is just a big umbrella term that can actually is okay involve okay as a whole different varieties of cancers. Okay, so where the mainly is okay determine which kind of cancer it was is going to be okay in the Department of Cytology, where they do studies on the tumor or mass underneath a microscope. But what they look at is the cells. Okay, so again, yes, okay, another example where the word means one thing and the term ends up means something differently. Or even as okay, if you look at it, well, okay, as cytology is okay, they still study the cells for the changes. Did you guys get that? Okay. Now pap smear, okay. Most ladies will know about that. What that is? That's means okay, just a screening test for uterine cancer. Okay. So what is that they do? They just scrap off a small specimens of cells from the neck of uterus and send that off. Okay. Okay. Not okay as the whole uterus, just okay a small specimen of cells, and okay they send it off, and okay that specimen is going to be as okay be studied. And if they find any cells that look suspect, they may as okay keep they may keep that person in a tighter rope. You probably as okay I come in, I have to come in more often to just okay get your pap smears done. Okay, so there's your cytology. Okay, so the term as okay, the word may just mean it's okay study of cells, but it's actually going to be as okay. Will be as okay study of cells to detect cancers. Now, okay, although it's okay, the hair says okay, or the hair is okay, use it as a root word. But it's okay, the word sit or side can also be as okay, become a suffix. So when we use it, for instance, okay, as a suffix, it becomes site, which means it's okay, it just will mean, what the, sorry, still it's okay, will mean cell. So it's okay, if you use it as suffix, it becomes site. And just a couple of examples. There's going to be as okay, what we call a leuco, or we can say leuc. O is okay as our combining vowel, and site. Now here is okay, the word leuk, L-E-U-K. Actually, it's okay, means white. Okay, so if you just look at it, it remains as a meant white cell. Okay, but there actually is going to be a type of cells which we call white cells, or actually more correctly would be white blood cells. So what we in common terms will refer to as a white blood cell, technically will be referred to as a leukocyte. Did you guys get that? Okay. So you may have heard, okay, well, we're going to just, okay, run some tests. Or, okay, yes, okay, get a white blood cell specimen, a count or something like that. Leukocyte count. Another kind of cells is what we call, let me just, and again, yes, okay, site. Okay, it's okay. The side is still going to, it's okay, B cell. The O is okay, or favorite is okay, combining vowel, and the word erector actually means red. So red cells, which kind of red cells? Well, okay, here again, blood cells. Okay. So a technical word for SOK, what people may just call SOK, the red blood cells, is going to be erythrocytes. Okay. We can take another site. We can say it's okay, myocyte. Oops, sorry. Okay. Now here it's okay, the O is not a combining vowel. Okay, the word myo itself is going to be, it's okay, a word that means muscle. And site is just going to be cell. So muscle cell. Okay. So all your muscles in the body, or yes, okay, wherever you find muscles in the body is going to be made up of muscle cells, also known as myocytes. Clear? We can take one last example. Neurocyte. Again, here is okay. This is going to be cell. O as in orange is your combining vowel. And the word neur, N-E-U-R, is for nerves. So what we actually, it's okay, can call a nerve cell can technically also be referred to as a neurocyte. Okay, and this neurocyte or nerve cell may also have okay as another kind of, as okay, may also go under another name, which is going to be a neuron. Did you guys get that? So a neuron is the same as a nerve cell, which is the same as a neurocyte. Did you guys get that? Okay. Any question, ladies and gentlemen? Nope. Any word of wisdom? A word of wisdom can be, yes, okay, the punchline from your favorite movie or whatever. Or a wise code or something.
Quick question. The red blood cells were called what again?
Erythrocytes.
Erythrocyte.
Yeah. E-R-Y-T-H-R-O. Where the word erythr, E-R-Y-T-R-H, mainly means red. O is just your combining vowel, and cyte becomes cell.
Okay.
Okay, so erythrocyte is just another word for your white blood cells. No, sorry, red blood cells, sorry. Leukocytes is your white blood cells, where leuk is white, O is your combining vowel, and cyte is cells.
Erythrocytes.
Yeah. Anything else, guys? Should we take one more cell? Which is still going to be okay. Side is still going to be cell. But we can see, let's do this guy. OST, and then we have O as your combining vowel. So OST, guys, is just bone. Okay, so osteocyte is just going to be bone cells. Here. Any question, guys? Nope. Okay. Now here's a fancy one. Because, okay, you say enter. Or you spell it as enter, as in English. Now, what does the word enter means in English? Get inside, right? Right, okay. Or if you say entrance, what is an entrance? The pore through which you enter a building, right? How do you enter a building? Or a room? Well, okay, you say door. Okay, but that door will be, yes, okay, the entrance to that room, right? Okay, now here enter doesn't mean the way to enter. The word enter actually in this case is, okay, in medical terms is going to mean intestine. Now, guys, some of you may have heard that, okay, as when we talk intestines, we have two types of intestines. We have, okay, is what we call the small intestine. And we have, okay, what they call the large intestine. Okay, guys?
Is the way you pronounce it intestine or intestine?
It depends upon your accent.
Wow. Okay.
Okay. Some people may pronounce it okay, intestine, some people may pronounce it intestine. Okay. It depends upon whether you're from the north or the south, or east or west. Okay. But whichever it is, yes, okay, we may have small or large intestine. Now, guys, when we say it's okay, when we use the word enter, that is mean, yes, okay, going to be referring to the small intestine. Okay, which means, okay, just use that with the question. And okay, if enter is your small intestine, what term do we use for the large intestine?
Is it the colon?
Colon.
Yeah.
Clear? Okay. Now there is also a last name. Anybody know somebody whose last name is colon or colon? No, okay. I don't think that's what they meant. When they say, okay, well, we're going to go under the family name of colon. Anyways, okay. So yes, okay, that's what you refer to as the large intestine. Okay, guys. Okay. So small intestine, colon, sorry, enter, large intestine, colon. Now then we can just go on and say that if we have enter itis, mainly as okay, infection or inflammation of the small intestine. Clear? Okay. What would that have been for the colon? We call itis. Okay. We can also say it's okay, we may have enter. We may also still have itis. But here it's okay, we just going to just okay, put another root word together with enter for the small intestine, which is going to be gaster. And of course, it's okay, just to make it easy to pronounce, we combine it with a combining verb. So it becomes gastroenteritis. Okay. Well, itis is still yes, okay, infection or inflammation. Enter is still yes, okay, your small intestine. Whereas, okay, gastro is going to be the stomach. Okay. So gastroenteritis is going to be as okay, infection of the stomach and intestine. Did you guys get that? Enteritis is just going to be as okay, inflammation of the intestine alone. Which intestine is okay? The small intestine. Did you guys get that? Right. Okay. We can also say it's okay. Let's take a look. Enteric. Okay. Okay, here's a funny one. Enter. So yes, okay. Intestine to be more accurate. Yes, okay. We can say it's okay. The small intestine. Air. ER, and as the suffix, use L for chaining to. So parenteral. Okay. Now this has nothing to do with parents. Okay, guys? Here the word par or par actually is okay, is derived from the word parallel. The word parallel actually is okay, or mean alongside or side by side. Okay, through the intestine. Now maybe it's okay a little bit off. And now when we use the word parenteral, it's going to be when we say it's okay, parenteral nutrition. Have anybody ever heard of that fellow? Okay, guys. Now, usually it's okay if you are in need of nutrition. How do you get it?
Food consumption.
Food consumption. And how do you consume food, my dear?
You eat it.
How?
And by
You
chewing.
put it in the mouth, right? And idea is okay, from the mouth, it will go to your
Digestion?
stomach, to your intestine, and so on. So, right, okay? Okay, and pretty much okay, in the intestine, that's going to be as okay where the nutrients from the goodies that you consume are going to get absorbed into the blood, and it's going to be the job of the blood to just okay distribute those goodies to the body where it is needed. Did that make sense? Good. Now, God forbid, due to whatever reason, somebody may not be able to consume food via mouth. Okay, patients in coma, for instance, they can't eat, they can't drink. Okay, the only thing that's different between them is that okay, as they have just went into a deep sleep. But the rest of the body still works. The heart still beats. They will still be breathing, so on so. So they will still need energy for those body functions to be performed. And where that energy going to come from? Food, but they can't eat. So what do they do now? Give the patient parenteral nutrition. Where does that go? Directly into the bloodstream. So you may, as okay, especially as okay, if you go to as okay, intensive care units and places like that, you will see people who is okay, just like that, and okay, as a lot of yes, okay, big IV solutions are going to be administered, and some of them may actually be drugs, but some of it may also as okay be nutritions. So since that's okay, those nutritions actually as okay never makes it to the gut. That's why they call it okay parenteral nutrition. Okay. Where it's going to be okay. Par is from the word parallel, which means okay means side by side. Just like two lines, parallel lines, can go from here to the moon, from the moon to whatever other crazy planet in the cosmos that you may think. But since they're parallel, they're never going to cross. Pretty much based on that, that's why I say, okay, it never makes it to the gut, and it never comes from the gut or the intestine. Okay. So here par is from parallel. Did you guys get that? Okay. So, but normally, yes, okay, if you are in need of food or you're hungry, then what do? Scooby-Doo, you just go to the kitchen, open the refrigerator, pick up anything that you may be craving for, and okay, yes, attack. Right? And then it's just okay, it's okay, it goes through. So that's okay. But parental, that's okay. At the first term, it may, as okay, or at first sight, it may look as something that has to do with parenting. No, not necessarily. But okay, maybe. Okay, you say, okay, food, just okay, goes in mouth. Okay. So, okay, now if you find yes, okay, I want to say yes, okay, pertaining to the, we do that? Okay, no, we didn't. Pertaining to the small intestine is just going to be enter. It, okay. So enteric is going to be as okay pertaining to the intestine. Okay. And not an ENT doctor whose name is Eric. Okay. So well, any questions, guys?
So enteric, it's pertaining to the small intestine.
Exactly.
Thank you.
Okay.
Question. So what would you write like for the definition of the parental? Sorry, I can't
But,
say it.
but okay. Okay, the actual whole term will become yes, okay, what we call yes, okay, parenteral nutrition. But the reason that we call it okay, parenteral is going to be because par is derived from the word parallel, which means alongside or side by side. Enter, small intestine, L, just your suffix that means pertaining to.
Thanks.
Okay. So you can mean it says, okay, if you want to say what this whole thing was, it's mean it's okay. Nutrition being directly administered into the bloodstream. Okay. Now some of you have said, then what about a feeding tube? If somebody has a feeding tube, is that going to be parenteral? No. Because okay, we have feeding tube, okay, it just go to the stomach. And after that, okay, they go, yes, okay, through the intestines and so on. So. Okay, so a regular feeding tube is not going to be parenteral. Did you guys get that? So usually it's okay, parenteral is mean is okay, that the nutrients are is okay, directly mean administered into the bloodstream. So we bypass the gut. Now, just a funny question, but okay. A person who doesn't eat because he is in coma or whatever, due to whatever reason, XYZ months or so and so, do they still poop?
Yeah, because they're still getting fed. No, their brain's not working.
Because they're still getting what?
Fed, like they're still getting the nutrition. No.
But the nutrition doesn't enter the gut. So why in the hell would they have to poop? Well, they still poop. And some of you guys say, but where in the hell does that poop come from? If nothing goes in, nothing should come out, right? Right? Okay. Second thought is that, okay, yes, your gut, even though you don't eat or drink, for that instance, may still be as okay, continuously as okay, shedding off its linings and so and so. You just don't see it when it comes out in the poop because it's mixed with other stuff. Right, okay. Right. So yes, okay. And now getting that poop out of a comatose patient or a sedated patient is going to be a little bit more than or it's okay, more difficult than said. So it's okay. Occasion is okay. It may have to just okay do stomach washes or lavages or enemas and all that. Just to trigger that's okay, some sort of bowel movements to it's okay, cause the guts to it's okay, empty out. But it's okay. There's still going to be it's okay, something that can be end up called poop. That's okay. Forming in the gut, even though it's okay, you ain't eating or drinking. Did that make sense, guys? Okay. Now, does anybody have any word of wisdom? No, not even a punchline from a movie, guys. You guys don't watch more movies? TV shows? KKUWK? Desperate Housewives, whatever. Okay. Grey's Anatomy. Anybody watch Grey's Anatomy? Okay, some Grey's Anatomy people. Do you guys know why in the hell they call it Grey's Anatomy?
I know there's a brand of like medical clothing. I think it's called that. I don't know.
Okay, good. Okay. So just because of a medical scrub brand, was that the reason?
Probably not.
No, it's called Grey's Anatomy because the main doctor's name is, her last name is Grey. Like, it's Dr. Grey.
Okay, so if he changed her name into a different color. No, guys. You guys never heard of Grey's Anatomy?
Isn't it a medical book?
It's the Bible of anatomy. So probably that's okay. The biggest reference book of anatomy is called Grey's Anatomy. Yeah.
Why?
Why? Because the author of it was Henry Grey. Here we go. That's why. No, yes, okay. I purchased that book back in 1992. Now, a lot of you might not even have been born at that time. If you were, yes, okay, you say, okay, I can't remember what happened in 1992. But that's when I purchased that book for 700 Pakistani rupees. No, don't go and ask what is that worth in dollars. Well, okay. Back then it was, that's okay, $35. Nowadays, that's okay, 75 or 700 rupees is worth pretty much nothing. But now it's okay. A couple of months ago, I went to Barnes and Noble and I found that okay, I could buy that same Grey's Anatomy just in a smaller print version for yes, okay, $7. So yes, okay, $35 back then and $7 now.
Do you recommend to like read that book?
No, that's going to be too much for you guys. You guys, even surgeons would not be reading that book as a whole. Not only is it going to be too much, but the labeling is also a little bit confusing on that one. It's not as a traditional book, yes, okay, where there are lines and okay, you see the word written here. No, actually, there's on the structure, they were right in there. So you can go to Barnes and Nobles and look at it. But yes, okay, it's too much. And that's why I says, okay, it's not really a textbook. It's a reference book of anatomy. So if you want, just okay, read about some crazy little super, yes, okay, microscopy or manicure. You say that's okay. Go ahead. You can find okay pages and pages and pages on that. But Grey's Anatomy is not called Grey's Anatomy because of the clothing brand or the show. But you can actually say, yes, okay, those clothing brands and the show actually is what's called Grey's Anatomy because of the book. Okay, peace be with that. So where were we? Okay, good. We were enter. Good. Let's see. Okay, here we go. Now we just use this word here, and that's why you go. I will see as okay as we proceed as okay. There are going to be terms that we already have talked about. So he says, okay, erether means red. Clear? The word erether actually means red. We just earlier said, well, okay, as we combine it with an O, and we said site. Now that just becomes just okay, what we'll call is okay, the red blood cell. Did you guys get that? Okay, so as you said earlier on the previous slide, that okay, a technical term for what we will call the red blood cell is erythrocytes, where the erythro actually means red. Now let's just talk about some other redness. Because there's going to be a term that will be eryther. Ema or erythema. Now, guys, just to give you guys an example, do you remember when we talk about, yes, okay, hammering the nail with a hammer? Did you guys remember that one? Now, what happens if you miss that nail and hit your fingers?
You smash them?
Okay, it depends upon how hard you hit.
You're gonna be in pain.
Okay, good. You're going to be in a pain. Okay, what else is going to happen?
Your finger will swell.
Swelling up. Okay, good. And what is that swelling going to look like?
Red.
Red. And what do we call that redness? Erythema.
Oh.
Clear? So that redness that you develop, most likely as okay, as a result of inflammation, is called erythema. Okay, well, that's because, okay, you missed the nail and hit the nail of your finger. Okay. Okay. That's swelling. That's okay. The swelling is going to be swelling. That will be edema. But it's okay. Maybe it's okay because it becomes red looking like. Okay. That red looking appearance is going to be, that it will be referred to as being erythema. Okay. Have you ever watched cartoons where, okay, Mickey Mouse or whosoever hurt his finger and you see that, okay, yes, the finger is okay, bum, 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 like this, and it's red. So that redness there means is okay in the case what we in technical terms will call erythema. Did you guys get that?
Is there a definition for EMA? Like, does that mean
EMA, well, okay. Here we can mean says, okay, the word EMA is just going to be, because it's okay, a term that will refer to the tissues. So redness of the tissues. Clear, okay.
Thanks.
If not, well, okay, yes, you just smash your fingers, right? Okay, don't do that. But okay, okay. Um, in any case, that's okay when you get hurt, and okay, yes, that area that is hurt appears red. It means okay because of okay is reddening of the tissues. So we can use that okay the word EMA can be referring to as okay tissue. So reddening of the tissue. Okay, guys, let's just go back to yes, okay, to our erythrocytes. Because there are some of my yes, okay, I can say yes, okay, favorite terms. And why are they going to be my favorite terms? Because they're going to be brought up again and again and again. Okay, so one is going to be yes, okay, what we'll call erythra. We will have yes, okay, or combining vowel, which is O. We will have the OE, and then big sister, sis. And if you guys remember from what I said earlier, when it ends with cis, this meaning means that, okay, this whole word here is going to be as okay, process of. Process of what? Well, okay, something that has to do with, okay, yes, the red. Yes, okay, the red is actually okay, going to be as okay, referring to the red blood cells. But they then put the whole word erythrocyte, because then it's going to be as okay, become as okay, it's okay, too long. So if we just says okay, suffice, let's say yes, okay, erythra. Okay. The O is our favorite is okay, combining vowel. And then it's just the question is, what in the blue is POIE? P-O-I-E. Now this mainly is okay, will mean formation. So what is that? Erythropoiesis is going to be? Is going to be the process of formation of the red blood cells. Did you guys get that? So erythropoiesis is the process of formation of your red blood cells. Any questions? Okay, guys. We just take it one step further. And we're just going to copy and paste. Copy and paste. Copy and paste. And then just okay it here, use another term. In. Okay. Now here's okay in the chain. You can make this okay. It's me is okay going to be it's okay the word in. Now guys, when you see the word in, especially it's okay if this is because this is going to be a substance. So this is actually, but what that would tell us is that this substance here actually is going to be a protein in nature, or by nature is going to be a protein. Okay, okay. But what will we call it? We'll call erythropoietin. Or what in the blue is that erythropoietin is? It's a substance by nature, chemically, yes, okay, it is a protein. Functionally, guys, this is going to be a hormone. And a hormone, that means, yes, okay, is going to stimulate the production or formation of red blood cells. So your body produces a substance called erythropoietin. Clear? Okay. What's going to be the function of this substance? Or hormone, to be more correct. Its function is going to be to stimulate your bone marrow to produce red blood cells. What do we call that substance? That substance is called erythropoietin. What is it going to be responsible for? Erythropoiesis. Okay. So here's okay, the tin is okay, that's going to be okay. Now please don't say that the word tin means hormone. No. This whole substance, erythropoietin here, is functionally as okay, it is a hormone. Okay, but a hormone is okay. That is going to be as okay. Okay. For the formation of red blood cells. Okay. So the hormone or the substance is called erythropoietin. The process by which, okay, as your red blood cells are developed or formed is going to be called erythropoiesis. Did you guys get that? Now, has anybody ever heard of what we call kidney failure? Good. Now, what happens in kidney failure? What's the main thing that happens in kidney failure?
Does your body stop producing insulin or no?
Kidney failure, my dear.
Oh, kidney failure. I don't know. I guess I don't know.
Okay. We can say
Is
the
it
kidney fails.
glucose? Oh.
The kidney fails, right? Okay, what's
just
going to be the consequence of failing kidneys? No PP will be produced, no urine. The function of your kidneys was to produce urine. Did you guys get that? Now, why in the blue would I bring that up here? Because that erythropoietin that we just talked about, where's that produced? In the kidneys. So in kidney failure, it's not only that, okay, the kidneys fail and won't be able to just, okay, produce urine. They will also fail, and okay, as a failure of the kidney mainly will mean that, okay, they will not produce erythropoietin either. And just think of it that, okay, as your body mainly as, okay, works on messages sent by different areas of the body to different areas of the body. Right?
So is erythropoietin in the kidneys?
No, it's
Is it
produced
located
by
in
the kidneys. It's produced by
Oh,
the
okay.
kidneys. Okay. Okay, so it's going to be a substance that your kidneys produce. But what will that do? That will go and, okay, as tell your bone marrow to produce red blood cells. Now, if the message is never sent out, then how is somebody going to be able to respond to it? Let's say, as okay, some of you want me to do something. Repeat chapter 6. Okay, you want me to do that, but you fail to send out a message or an email. How would I know? Clear? Okay, so if the kidney doesn't produce erythropoietin, you can say it's okay, no news is good news. The bone marrow doesn't get the message to produce red blood cells. And what happens then? The patient is going to become anemic. Not just that, okay, as all the waste material that, okay, as you pee out in the urine is going to be circulating in the blood. And sooner or later, yes, okay, that person is going to go cuckoo. You guys know what cuckoo means?
Crazy.
Nuts. Yeah, crazy. Okay, so yes, okay, usually the friends and family will bring him into, yes, okay, to a psychiatrist first. Because, okay, he's talking crazy stuff. Okay. So that's okay. A lot of patients, we had a lot of those. That's okay when I did my medical externship, kidney failure patients. Primarily due to SOK, what you can call SOK self-medication, that they indiscriminately SOK take medicines without medical advice. And drugs that is easily available. Now, don't do that experiment. It's not recommended. Things such as ibuprofen, Aleve, and so on. So they can easily smash your kidneys if you overdose on them. So that's okay. If you don't get relief for the pain, that's okay. You may need something stronger. You don't just go on and take, okay, yes, close to lethal doses of a medication. But people will not get that, so they end up smashing their kidneys, not with a hammer, but functionally, it's okay, pretty much okay, as just destroy them. And then there was only two options. Either wait for us, okay, somebody who was able to donate a kidney, or as okay, lifelong dialysis. Which is not cheap either. So
So when people are having like a kidney failure, since they're not producing the what was it, the erythropoietin? I can't say it.
erythropoietin.
Erythropoietin, which is a hormone that produces red blood cells. It causes them to become kind of nuts, or like, I guess.
No, because you don't produce urine.
Mm-hmm.
Now, what is it that you pee out in urine? It's not only water, my dear.
Right.
It's a lot of, okay, as what we can call as, okay, metabolic waste, primarily, or toxins that,
The toxins just going all over their blood cells.
yeah.
Or,
So if that gets to your brain, yes, okay, you're going to become, that's okay.
is it reversible? Like the
Kidney failure?
no, the craziness or
Yeah,
whatever.
okay, once the patient gets his dialysis done, you may, it's okay, just filter out all those crazy materials or crazy, that's okay, waste materials. He or she will come back to normal.
Think.
Right, okay. But the kidneys will probably never come back to normal. Once failed. Okay. So. Okay. But that's okay. Just in the word, that's okay. Erythro, yes, okay. I think there was, okay, yes, a little bit of interest. But please, guys, we will talk about erythrocytes. We will talk a bit about erythropoiesis, which is the process of formation of red blood cells. And yes, okay. We can even, yes, okay, briefly just mention, yes, okay, erythropoietin, which is a hormone. Now you can do dialysis to, yes, okay, filter out all the waste product. What about the blood? So do you just keep on giving those patients blood transfusions? No. But how are they going to be producing red blood cells then? They don't produce the erythropoietin.
Don't they take out the blood and separate it or something for them?
That's what happens in dialysis, my dear. So they actually, as okay, produced erythropoietin in the labs that people can get as shots. Have you guys heard of what his name is? Let's make sure I choose the right Armstrong.
Lance Armstrong.
Lance Armstrong.
Yeah, I remember that.
Okay, probably that's okay. One of the drugs or the drug that he might have been using was erythropoietin to just enhance the production of red blood cells to induce his stamina. So have you been following Tour de France? Or you just remember his name?
Oh, I remember when he had his title stripped because he was blood doping.
Exactly.
Yeah.
So that was probably just okay, the substance that he would have used. So, anyways, So doping, moping. Okay, so that was just okay, your erythras. Yeah, okay. So you see, yes, okay, just one fraction of the word, yes, okay, change, and it gets a completely different meaning. Okay, now the reason that I say it's okay, well, chemically or functionally is going to be a hormone. Chemically is going to be as okay a protein in nature. And how do we know that? Mainly because it ends with in. Okay, we'll talk more about these things that's okay in anatomy physiology.
So did you say N means a protein?
But that mainly is okay. What indicated my idea is that whole substance is a protein.
Okay.
Erythropoietin, chemically speaking, is a protein. Now, what would we call a protein? We're not going to be talking about that now. Okay, what makes a protein? And so we talk more about that when we get to anatomy physiology. Okay, but a common thing about is okay proteins is that their names would always end with in. Clear? Let's just go to our next word. Which is stomach. Okay. So gastro or gaster. Now we can say it's okay. Gaster. Ick. Pertaining to the stomach. Okay. A common phenomena, yes, okay, condition, yes, okay, pertaining to the stomach, maybe, yes, okay, what you call a gastric ulcer. Okay, what's an ulcer? Ulcer, yes, okay, maybe, yes, okay, just a little bit technical word for yes, okay, or maybe, yes, okay, just for mean a wound. Okay, so pretty much, okay, as if somebody is okay, develops a wound. In the stomach. That will be referred to as a gastric ulcer. Okay. The ibuprofen, the Aleve, the Advils, the Voltaren, the naproxen, all those medications not only your kidneys if you overeat them, but it's okay if you take those on an empty stomach may actually it's okay cause a stomach ulcer. Okay. Okay. What usually will happen in case of stomach ulcers is heartburn, or what people call heartburn. Okay. Now that doesn't mean that your heart is burning. They just call it heartburn because it's that burning sensation close to yes, okay, where your heart is. So the heart and the stomach is okay are okay, not really, but it's okay, closely located to one another. Clear? Okay. So that's why it's okay. Sometimes it's okay. Heart attacks that chest pain may just feel like stomach ache and may be dismissed wrongly. And the patient walks down the street, and okay, right there. So yes, that can happen too. Okay. Well, that's okay. Gastric ulcers mainly as okay. If you don't want to use the word gastric ulcer, well, okay, just going to be as okay. Stomach ulcers. Okay, but what is that? The ulcer going to be as okay? Just a wound. Okay. Just like okay, as patients who, for instance, okay, are bedridden or lie in bed for as okay extended periods of time, may develop what we call pressure ulcer or pressure wounds. Right? Okay. Why? Mainly because okay, they have to be twisted and turned around periodically. So usually they'll say, okay, every 2 hours the patient should be tilted to one side or to the other side. Okay. So that they don't lie as okay on their back all the time, because that's going to cause ulcerations, what you call pressure sores, pressure ulcers, or it's okay wounds. But if you develop a wound in the stomach, okay, that's going to be called a stomach ulcer or gastric ulcer. Okay. Now, we always say it's okay, gastroenteritis. We can say it's okay, gastro or gaster. Of course, that's okay, combining vowel. And that's because, okay, we make a pat, and again, it's okay, a combining vowel. And then we can say it's okay, logic. So gastrohepatology. Okay, now we can just look at it in this way, guys, and say it's okay if you say simple gastrology. A person, I mean, it's okay. It's okay, there's the specialty dealing with stomach diseases. Okay, stomach ulcers, heartburns, blah, 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 so and so. On the other hand, you can say it's okay separately, it's okay just hepat. O and logy. So it's okay, me is okay just dealing with disease of the liver. But then there are actually, it's okay, people who specialize in both. Why? Mainly because it's okay, diseases of the stomach is commonly seen as okay, associated with liver diseases as well, or vice versa. So that being combined, 1 + 1 makes 2. Okay, combine into one, become this okay, gastrohepatology. Did you guys get that? So it's okay, gastrohepatology with me is okay, just be it's okay. You're studying about the diseases of the stomach and liver. Yeah, okay. And somebody will say, okay, why don't we call it hepatogastrology? I think gastrohepatology sounds more chick than the other way around. Okay? Not that it changes the meaning of it, but it also has to sound good. Did that make sense? Okay. Any questions? Nope. Okay, so that's pretty much okay how you may put multiple words together. But of course, okay, there has to be a relationship. Okay. You can't say gastroophthalmologist. No relation between your eyes and the stomach. Okay, so there has to be some sort of clinical relevance between the two, or three for that instance. Okay, what else can we talk about? Gastro. Now we can see, sorry, gaster, ick, pertaining to, yes, okay, of course, stomach. Okay, but we may say as okay. Subgastric. In other words, sub, under or below. Did you guys get that? Okay, so something is below the stomach is going to be, now this here is the stomach, this will be subgastric. We can also do another word in terms of stomach and positioning or relation to it. Then we say it's gaster, ick, just as or pertaining to what? Stomach. Okay, or what stomach? Retro. So retrogastric. Now the word retro here actually is going to mean behind. Okay, so if you, for instance, look at the stomach. That says, then we take a side view. Let's say this is the stomach. I just say that, this here is the front or anterior wall of your abdomen. What's going to be behind the stomach is going to be what we may refer to as being retrogastric. The word retromanias, just means behind. Did you guys get that? So subgastric will be below the stomach. Retrogastric behind the stomach. Any questions or concerns, guys?
Actually, I have a question. So if
Go
it was
ahead.
if it was above the stomach, would we be using the word cephalic or no?
No. For that you mean yes, we use supra.
Supra. Okay.
But we'll get to the more specific, yes, what you can call it directional terms and so on. So in the next chapter there.
Okay.
But since we just here is okay, we'll just talk. Okay, but you can say it's okay. It's where we mean it's okay. It's related to the stomach. But if you says okay about the stomach, it could be it's okay supragastric. Okay. Good. Now a famous or is okay a funny one. Which is going to be it's okay the GNOS. And guy here we may as okay just come across two words. Okay, we can say it's okay. It can become this. So genosis. Now it's okay, this now then just becomes a procedure, right? Now what the word genos would mean is knowledge. Okay. And the two terms that you commonly as okay will see is going to be dia, genos, is where the word dia actually means complete. The genos.
So the word, oh, sorry.
Just a second.
Okay.
The word genos mainly is okay. By itself is okay would mean knowledge. Or we can say it's okay. If you have knowledge, it's okay to know, right? And cis mainly is okay, that's okay as the procedure, a process of. So what now we don't pronounce this word here as diagnosis, right? You pronounce it as sorry. So you'll say, well, what kind of G is that? Sorry. You say it's okay, diagnosis. Or you, yes, okay, you can say diagnosis. Now, have anybody ever heard of the word diagnosis? So what is a diagnosis?
It's like the complete findings that, say, a doctor would find for a patient.
Exactly. Okay, you go yourself, okay, I've been coughing, I have fever, okay, runny nose, this, that for XYZ amount of days, right? Okay. He may dig further into yes, okay, your symptoms. May yes, okay, look in your throat, look in your ears, listen to your heart, do all that. At the end of okay, as based on your history, based on okay, as him digging into yes, okay, the info that he was able to dig out of you, by yes, okay, further asking into the things. And okay, the findings by us, okay, looking at your throat and your ears, your eyes, listening to your heart, lungs, and all that. He or she is okay, gets somehow okay, we can call it okay. Because it's okay, solid guess of okay, what is wrong with you. Okay, so that will be as okay. So by me, that's okay. And that's why it says okay. Now, if you look at the word, it just means it's okay. complete knowledge. But complete knowledge of what? What is wrong with the person sitting in front of you? If they're still in doubt, they may say, well, okay, we probably think that, okay, this and this and this is the case, but we may need to do some tests. A test could be for it. Could be, yes, okay, for instance, okay, ultrasound. Okay, so what is that an ultrasound is going to be? It's going to be a diagnostic procedure. Okay, now why do we call it diagnostic procedure? Pertaining to a procedure pertaining to the diagnosis, of which will help in the diagnosis. Because then you come with your probes, your gel, your ultrasound machines, start scanning, and you see something that, okay, yes, the doctor couldn't see with his eyes, couldn't feel with his hands, or whatsoever. And you say, well, okay, here we go. We have a picture of it right here. Good. Yes, okay, the diagnosis that you had was correct. We just confirmed it now, right? Or the other way around. Did you guys get that? Okay, so that's going to be as okay, diagnosis. Now from diagnosis, you can say it's okay, diagnostic. That's going to be pertaining to diagnosis. Okay. Diagnose will be the verb. You diagnose something. What you get as a result of that is going to be a diagnosis, which becomes a noun. Clear? Okay. And okay, as pertaining to that, it's okay, diagnostic. Okay, usually it says, okay, diagnostic procedure, that will become as okay, things such as lab tests, blood work, etc., different kind of scannings, you name it, right? Those will become diagnostic procedures. Okay, so that's what's happening here and now. Now, once that is done, they may come and say, well, okay, here's the treatment. You got a diagnosis, here's the treatment. Please make sure that you take this medication, or okay, follow this treatment plan here as stated. Otherwise, that's okay. What we see in is okay in the glass ball is okay as a diagnostic. Right, okay. Okay. Or where the actually is okay, may is okay. Predict what may be the possible outcome. So that prediction of a possible outcome is going to be as okay what we will call prognosis. Now, where the word pro here. Now, pro here is okay, it doesn't mean it's okay professional. Like a pro football player or something like that, okay? Here, the word pro actually means it's okay before. The G and OS, gnos, it's okay, still means knowledge. Or we can say it's okay to know. And here we just say it's okay, it says yes, okay, this is because it's okay, the process. But it's going to be as okay, actually pronounced as prog, no, cis. Yeah, okay. So had it ever happened that you went to the doctor or whosoever. They say, okay, well, this is what we found. This is our diagnosis. And you go and say, okay, now what's next? Now, when he narrates that long story of what's next, that's prognosis. Okay? Or you can make it as, okay, the possible knowledge of possible outcome. Okay? Now, prognosis is probably as, okay, a term that is more widely used in when talking of cancers and so on. So, where they have this 5 years measure line. That this, okay, in 5 years, okay, so on. So you may have, okay, as a 90% chance of survival for 5 more years. You may go beyond those 5 years. You may not make it. And that's just because, okay, you didn't fall into that 90%. You were of those 10 unfortunate percent that didn't make a survive for us, okay, 5 years or whatever. Or mainly it's okay, you can say, what is the prognosis? You can mainly say, it's okay. From the word, mainly it's okay. May know ahead of time what may happen next. It happens now. Yes, okay. Lucky for you guys, you're probably not going to be seeing that, but there's been a lot of instances that's okay where we looked at a patient and we said, okay, there's probably not much that can be done here. Just wait and see. Most likely, it's okay. The patient may die within a couple of hours. If it drags on for, it's okay, unending time, that's okay, maybe a couple of days. But right now, it's okay. The prognosis is dark. Or you can say there's no hope at the moment. So what do you do then? Wait and see. What can you do when while the patient is waiting? Just say, okay, pray for him or her. So that's okay. Somehow it's okay. Trying to foresee a possible outcome. That's what you call prognosis. Okay. Now, have you heard of the guy who had a good prognosis? There was a guy who had a good prognosis. And who gave him that good prognosis was the nurse. Never heard of him? No? Yes, you heard of him?
Yeah, he's not around to tell the story anymore, right? Is that the joke? No, my dad tells me a joke like that. No?
No, okay, it's different.
Oh, okay.
Now, let's see. So there was a guy who was going to undergo a procedure. And he, before it's okay, they were about to put him to sleep, he just asked the nurse, okay, what is my chances of survival or having a successful procedure? And the nurse goes and says it's going to be 100%. And he goes, how are you so sure about that? That I'm going to make it. And she goes, because the success rate of the procedure that you are going to undergo is 1 in 10. Success rate is 1 in 10. So only one patient out of 10 makes it. And he goes, okay. So what's next? She goes, Well, the doctor who is going to operate on you have already performed 9 procedures like this, and they didn't make it. Now you are the 10th. There you go. That's the prognosis. Now maybe that doctor was the reason that, okay, yes, that procedure has such a poor success rate or poor prognostics, right? But okay. But yes, okay, if any patient that he touched and okay, then okay, better keep him away. Yeah, okay, okay, why not? Why not? Okay. But oh God, we had one. We had a doctor in anesthesiology, and pretty much okay, all of the patients that he would put under, they were dying on the table. Not that we did anything wrong. So what did we end up calling him? Yes, Hifza. Do you know who Israel is? Not Israel, Israel. Asma?
Yeah, angel of death.
Angel of death. So we call him Israel, not with an S, but with a Z. That's the name of the angel of death. Because, okay, any person that he sedated or is okay, put under. So when we walked into the operation room and saw him, that's okay, we asked, do you mind bringing your supervisor, please? Because we don't intend to go out and tell the friends and family that, okay, sorry, but okay, your patient died on the table. So, okay, well, that's okay. There's no escape from him. You may escape a quiz, you may escape a final. You can't escape Israel. Okay, guys. So you never heard of Israel? Hifza?
I didn't know that's what you were referring to. I was just confused.
Okay. Good. So those are the two G noses. Okay, but that's okay. The G of the G nose actually is okay going to become connected to the prefix. So if dia means complete, does Diana mean incomplete? That's the question. Complete? Nah. Anybody know who Diana is? OMG. Nobody know anybody by the name Diana?
The Princess of Wales.
Okay. Ex-Princess of Wales. Okay.
Ex-Princess of Wales.
Who is the current Princess of Wales?
Kate.
Kate. Yeah. Okay. Any other Diana? I guess you guys don't listen to music either.
Diana Ross.
Ah, here we go.
Yeah.
Fuck. Okay. Yeah. Okay. But Diana, that's the Greek goddess for hunters. Okay, guys, some of you may be as okay starving. I don't want you guys to as okay develop gastric ulcers because I'm keeping you from going and having some goodies. So go have your goodies, and I see you guys back at, should we say, 12:50, 55. That's fine. Okay.
Okay.
Okay. Take care, yeah. No. Before we continue, any questions?
No.
No questions. Okay, doc. Let's just continue. Now the next word is going to be gynec. Of course, that's okay if needed. Maybe accompanied by, okay, the combining vowel. Oh. Okay, guys. Now, just so you guys are aware, this is how it's spelled in American English. The English spelling for gynec is like this. Okay. So that's okay. The actual official spelling is like this, but I guess each entry is okay. Check our letters. But what does the word gynec mean? That's okay, whether we spell it with or without an E, sorry. It can mean woman, or it can mean female. Yeah, okay. Now, guys, there may be a specialty that we call gynecology. Okay. Where he says, okay, that the word logio means okay to know. Woman or female. That's if you look at the words, that's okay, that's what it can mean. Okay. But no, the term actually means that's okay. Because it's okay. The specialty of diseases of the female reproductive system. Okay, that's going to be, it's okay, what gynecology is. Okay, now what we mean by the female reproductive system, we will talk about that in anatomy and physiology. Okay, but that's actually, it's okay, a specialty, it's okay, designated for diseases of the female reproductive system. Now then just the question, what about the male reproductive system? Who deals with the problems of the male reproductive system? That can't be a gynecologist. Huh?
Gynecologist.
No. Why would a gynecologist deal with a male reproductive system?
Gynecologist.
Huh?
An oncologist. Maybe I'm pronouncing it wrong.
How do you spell it here?
ONCOLOG.
No, that's cancerous, my dear.
Oh, okay.
That'll be cancer. We said yesterday that onco means cancer, right? Okay. Oops. So nobody deals with the male reproductive systems and its problems?
So a urologist?
Huh?
A urologist?
A urologist. Okay, so yes, okay, whatever you call it, yes, okay. Fractured penis, yes, okay, ED, etc., etc., etc. That's okay. And it's going to be, yes, okay, yeah? A urologist. So, okay. Now, and what do we call a person who has specialized in gynecology? He or she is going to be a gynecologist. Okay. Now, probably not that's okay, a term that you probably, that's okay. Now, you don't see it in your books, but, and that's why I say, okay, let's talk of something that's okay out of the book. But it's still going to be as okay, gynaec. We will still have an O. We will have the word mast. And it's okay, we can say it's okay as yeah. Now some of you say it's okay, had that something to do with the continent Asia? No. But the E, I mean, is okay, just indicate that, okay, this thing here is going to be, is okay, the name of condition. Now, what the word gynec means is, okay, is, we can say it's okay, female. What the word mast means is breast. We can say it's okay. It's just okay. Simplify. It's okay that as here, me is okay. Refers to it's okay. The development of. Well, please keep in mind, guys, that okay, as gynecomastia is not the process of development of the female breast. If that was the case, it would have been like this instead of ER. Because then it becomes a process, right? Okay. So where in the blue is it that this gynecomastia is? Okay, that is pretty much okay as if a male develops breast that looks like the female breast. And some of you may be asking, how in the blue world does that happen? No idea?
Overweight?
Don't go and say, huh?
Oh, being overweight?
Okay. Yeah, you can put it up. Okay. But
Hormones.
which hormones?
Mm.
Yeah.
Overproduction of of female hormones. They have too many female hormones.
But how would men doesn't have female hormones?
Steroids?
Okay. Which cause weight gain, right? There's actually an innocent medication available on the shelves.
Is it estrogens? Or androgens, something like that?
No, you can't buy estrogen or and progesterone without a prescription. Birth control, right?
Yeah.
Guys, no, okay, that's fine. There's an innocent medication on the pharmacy shelves that you can go and buy as much as you want to. Nobody's going to ask you why. Is it recommended? Probably not. But it's okay. One of its weird side effects is that it may lead to, yes, okay, gynecomastia, which may mean that the person may develop, yes, okay, or the man, not the woman, the man will develop, yes, okay, female looking like breasts.
What's that?
That's what you call gynecomastia. When men develop, yes, okay, female looking like breasts.
But what's
medicine? No, okay. It's a medicine for heartburn. That's all I can say.
Okay.
You'll find it in either Prilosec and Pepsid and all that. Cimetidine is its chemical name. So that's okay. One of its weird side effects or adverse effects is that, okay, yes, the man may develop, yes, okay, female looking like breast. Now, may he be able to breastfeed? No. Right. They don't have the mammary glands, okay? Okay, that's what's going to produce the milk. Now, can men develop breast cancer with or without gynecomastia? Yes, it's more common that some people may think 0.2% of males, that's okay, actually it's okay, may develop breast cancer. So 0.2, that is 2 in any 1,000. So, yeah. So here we can say it's okay, this mass that just becomes just okay. That's mainly it's okay, what does it mean? Breast. And that's when you can say it's okay. Breast, that's okay, masked, sorry. OMG. What the hell? Masked ectomy, right? Here. Okay, now ectomy itself, yes, okay, it is one suffix. Okay, but if you look at it, it's actually going to be made up of two words. One is going to be tomi, which mainly means cutting into. And here is okay, the ek actually is okay, comes from the verb ext or ect, which means out. Okay, so the whole word ectomy actually is okay, will end up as, it just says, okay, removal of. Well, how is that we remove it? Cut into and take it out. Clear? So here's okay, the act actually is okay, come from X, which means out. Just think of exterior. X, out. A technical word for act, out will also be act, which comes from X. Or if somebody have an X, if you broke up with somebody, he or she is your ex. And why is he or she your ex? Because he or she is now out of your life, right? Okay. Otherwise, you can label it after any other letter. Yes, okay, he is my P. Why X? Why not P? Why not L? Okay, so X means you out. Okay. Yes. No,
I just had a writing.
I
Oh,
don't
sorry,
have
what
an
you
X.
say?
I don't have an X.
Oh,
Okay,
well, that's good.
I'm just kidding with you.
Well, I was just writing in my notes the gynec mastia. What was the word as? Like what did that mean?
But
Definitely.
as, okay, as can, okay. We can mean it says, okay, because as, yeah, becomes just, okay, a condition. Okay, okay. But what mainly as, okay, makes a condition is because it ends with iya. Okay, so the as we can make as, okay, just putting it into context here is okay. Say it's going to be as, okay, a developmental condition.
Okay.
A condition of, okay, as where something is developed. What was developed? Breasts. Or you can say it's okay, female looking like breasts. Well, it's okay, just a funny term that, okay, yes, not funny, but a term, yes, okay, it brings us, okay, some other words into the discussion. Okay. Good. Okay. Okay. Now hem. And of course, that's okay if required with the following or with the combining vowel O. Or even, yes, okay, if you go, he met. And again, that's okay. If required, that's okay, maybe accompanied with the combining vowel O. And both these words here, whether it's hem or hemat, they both mean blood. Okay? Now let's just use a couple of terms that's okay when we use word hem for blood. So we can say it's okay, hem, O, globe, and I just write this last right here, yes. Although that's okay, globen is going to be one word. Globin is mainly as okay, just the name of a protein. How do we know that it is the name of a protein?
Lion.
It ends with N. Did you guys get that? Okay. Okay. Why is okay, one place where we might find just okay globin, or we find globin in the blood, that is going to be referred to as hemoglobin. Okay, we will talk more about as okay the structure of hemoglobin in anatomy and physiology when we get to talk about blood. Okay, guys. Okay, but what your blood will have is going to be as okay a substance that we call hemoglobin. Okay, it's pretty much okay as the substance that gives your blood cells, it's okay, the red blood cells, the red color. So this is going to be, it's okay, if you want to say, okay, what is that going to be? It's okay. The color or the pigment of blood is known as hemoglobin. We can check another one with heme. Hem, and of course, it's okay, all combining with O. Oh, let me do it this way. And then we it will be easier to explain. Now, when we see the word "and" with cis, what does that mean? That this is a process. Clear? Okay. Of course, that's okay. We have a process. That's okay. That is related to blood. Okay. Now, guys, here is okay. The ly. Okay. Now it's okay. What we actually had. Okay. What the ly actually is actually okay. Derived from the word that is going to be lyse. lyse. But you can maybe says okay. I did that. Yes. Okay. X this one out and say it's okay. Ended with is. Or he just says okay. ly and then cis just becomes just okay. The process. Clear? Okay. But there's going to be a process that we'll call hemolysis, which is going to be a process where, okay, yes, now you just have to know it's okay, what is it that the word lyse would mean? And the word lyse actually means breakdown.
I'm sorry, Professor. What does the word under cis says?
Cis process. This process. So anything that ends with cis is going to be a process.
Thank you.
So that's actually going to be a process that we call hemolysis. Now, if you say hemo is blood or hem is blood, always just the combining vowel. Lie is just short from lysis or lyse. Cis is means okay, called this whole term here becomes the name of a process. So there's actually going to be a process known as hemolysis. And what happens in hemolysis? That your blood cells, primarily okay, the red blood cells are constantly being broken down so that they can be replaced by new and fresh red blood cells. But that breakdown process of your red blood cells is going to be called hemolysis. Did you guys get that?
Wait, so it's the process of breaking down old red blood cells to create new red blood cells?
Okay, no, your bone marrow is going to produce new blood cells.
So it's just the process of breaking down the old red blood cells.
Exactly.
Okay.
Okay. But you say, well, okay, we need 2,000, or we need, okay, 50 billion cars on the roads. So add, okay, yes, 500 million of cars, that's okay, are taken off the road because the either, that's okay, get destroyed in accidents or the engine blows up and things like that. Okay, yes. Okay, they got to be replaced by new cars. But the breakdown process of, yes, okay, your red blood cells is going to be called hemolysis. Okay. But just so that those says, okay, those who are taken out gets replaced. That's when you will bye-bye to your X, you may say, okay, oh, okay. Okay. Okay, guys. All right. So from hemolysis, we can just go and say then, okay, what? We can say, okay, hemo, lie, and then we just go tick. Registers will come as, okay, you are pertaining to, right? Hemolysis. So we can mainly say, okay, anything that causes hemolysis is going to be referred to as being hemolytic. Did you guys get that? That's another one with hemo. And that's going to be, sorry. Hemo or hem is going to be as, okay. Hem is blood. O here is just okay, you're combining vowel. This is hemo, not homo. Okay. And we mainly is okay, we'll say the next term is going to be RRHAGE. Okay, which actually becomes as, okay, pronounce it as hemorrhage. Now here is, okay, the word RRHAGE mainly is, okay, will mean discharge, or in many cases, okay, flow. No, not flow, discharge. So it's okay when we say it's okay, hemorrhage. Or okay, the word may as, okay, mean discharge of blood. But this mean is, okay, just a fancy word for what we in plain English will call a bleeding. But where the blood that actually is lost out of the circulation actually is, okay, it's being discharged. It actually leaves the body. Did you guys get that?
I just had a question. What was the definition of hemolytic? Sorry, I can't say it.
Hemolytic?
Yeah.
Okay, my dear, okay. Is that going to, we can say, okay, anything that causes hemolysis is going to be considered an hemolytic.
Okay.
Clear? Okay.
Thanks.
Just like a driver drives the car. So whoever drives the car is going to be considered a driver, right? Okay. The teacher teaches. Okay. So the teacher is going to be the tick. And what he or she does is the cis. Did that make sense? Keep on. Sorry. Okay, guys. Now that's okay when we say it's okay, a bleeding, where the blood is being discharged, you can actually say that it leaves the body. That's what you call a hemorrhage. What if you bleed, but the blood doesn't leave your body? What do we call that?
Internal hemorrhage.
Okay. Or let me put it this way. You bleed, but you still see the blood, but the blood doesn't leave. That's when we go and say hemat. And here is, okay, guys, we're not going to be taking this O here, but we're going to do it this way. So it become a hematoma. Okay. Now, please, please, please don't say, because, okay, of course, that's okay. Hemat is going to be blood. And some of you say, so that this oma here is okay, that means tumor, which can be malignant and be cancerous. No. In this instance, yes, okay, or oma mainly, yes, okay, just means mass. And why do we call it a mass? Mainly because, okay, it's something that collects. So a collection of blood is what we in technical terms call a hematoma. In plain English, you just call it a bruise. Have any of you ever suffered a bruise? If not, well, okay, get into a fist fight with somebody, and okay, as either you give him or her a bruise, or he or she will give you one. Okay? For an example, a black eye is a bruise or a hematoma. Why do you call it a black eye? Because that's okay, it's me, that's okay, just a collection of blood or a mass of blood that collects. Okay? So that's okay, just a blunt force is okay where the skin didn't broke, but your blood vessels did ruptured due to the blow, and okay, you bleed. But that bleeding is going to be collecting as a mass. It becomes a hematoma. Right? If you're able to just, okay, break the skin, yes, okay, there may be okay, a little bit of hematoma, but that's okay, some of the blood is also going to come. So then you will have a hemorrhage or a bleeding. Okay, you hammering the nail with a hammer and missing the nail and hitting the other nail may cause that, okay, you have a bleeding underneath your nail. You have a picture of that in your book. Right, okay. A collection of the blood. Okay. Now, guys, please do not get uncomfortable, but it's okay. There's another kind of hematoma. Does anybody know any other example of a hematoma? That?
So I experience these subchorionic hematomas, right? That's another form. That's
Okay.
not really a bruise, right?
No, it's not going to be visible.
Yeah, on
Right, okay.
scans. Yeah.
Okay. Okay. But there's even something that they call as, okay, a subdural hematoma.
Yeah.
Okay, people with concussions and things like that. So that's going to be as, okay, just a collection of blood underneath the dura.
Okay.
Now, what the dura is, we'll talk about that in the next chapter. Okay. Right. So, have you guys heard of a hickey? Is there anybody who know what a hickey is? Okay, good. That's fine. You don't need to, yes, okay, disclose it. But that's okay. That's an example of a hematoma. Okay. A little unofficial name for a hickey is a low bite. That's a term that, okay, my teacher in forensic medicine used. Yes, okay. So Hickey is also, yes, okay, hematoma. But please do not say hemat, okay, blood. Oma, okay, tumor, mass, cancer. Then a black eye. That's okay. People who suffer a black eye is okay, maybe more serious ill than we thought in the first place, right? Okay, guys? So it's not always that oma means tumor. And that's why we say it's okay, tumor or mass. So in this instance here, it's going to be a mass. Is everybody clear about that? Okay. But it's okay if I just, and it's just a matter of, okay, switching one single letter in the whole equation, and okay, yes, it may become something completely different. Then it became hepatoma, right? Now what was hepat? That was liver. And that's why it's okay, oma would mean tumor. Not only any regular tumor, but that would actually, it's okay, be a malignant tumor. Okay. Now, guys, that's even going to be as okay a study of blood and blood diseases. Now, you may say, is that going to be as okay hemology? No, it's going to be hematology. So the study of blood or blood diseases is hematology. That's why it's okay if you suffer from blood diseases, you may need to see a hematologist. Did you guys get that? Anybody? Okay, now we just said, okay, it's here. Now, please. We earlier said it's okay, hemo. Shit, sorry. Lysis, right? Okay, what was this one here? The breakdown of primary is okay, red blood cells. Okay, now, guys, there's going to be a word that may be pretty similar to this, but you can easily, as okay, mix it up. And that's going to be hemo. Dialysis. What the hemo meant? Blood. What does cis mean? That means it's okay, just call it this whole thing is okay, it's going to be as okay, process. What did the word lie mean?
Breakdown.
Down. What did the word dia mean?
No, no, no.
Huh?
Complete.
Complete. Complete.
Complete. Okay, good. Now, is hemodialysis then going to be as okay, complete breakdown of blood? If that was the case, then all the blood you had was going to be completely gone. Now, earlier, when we talked of kidney failure, and I says, okay, you may go for a dialysis. Now, one of the methods that they use for dialysis is going to be what you call hemodialysis. That's where you actually, as okay, the person actually, as okay, gets hooked up to this big machine. Okay. Now, when I say hooked up to this big machine, because what are they going to do? Slowly, as okay, take blood out of his body or her body. They're going to be circulated in this machine, which means okay, they're going to filter the blood off the waste products, and that blood is going to yes, okay, get back to the patient. So that's a segment, yeah. That's a setting that can easily take yes, okay, 3 to 4 hours at a time. So that will be yes, okay, hemodialysis. Okay, which has really nothing to do with hemolysis. But the reason that I brought these two words up here side by side is it can happen for everybody. If it can happen for me, it can happen for you. You may step in the soup, as I did once. Yeah, tendency is okay, say, okay, talk about hemolysis, but instead of using the word hemolysis, I kept on saying it's okay, hemodialysis. And fortunately for you guys, that's okay. We cannot embarrass you. Our teachers would love to embarrass the shit out of us. So after me, as okay, been narrating that whole story for us, okay, 5-10 minutes, then my teacher goes and says, okay, so Dr. Bangish, all these things that you just talked about, are you talking about hemolysis or hemodialysis? So yes. Okay, Jen, you had a question, my dear?
Yeah, my sister has multiple sclerosis and
You don't need to, okay. You don't need to specify really. Just say, okay, I know somebody. Okay.
oh, okay.
HIPAA.
Okay.
Okay. Okay.
So, so I guess just never mind.
No. Okay, go ahead.
Okay. I was just gonna ask if that would be that would be called what she goes through, is that the process of hemodialysis is
Okay, my dear, unfortunately now, okay. I used to work at a Department of Neurology for approximately a year, and one of my main mentors pretty much okay specialized within cases of multiple sclerosis. And what we actually as okay would see as a common trigger of, you can say as okay, a further attack as they will call it, usually would be as okay, UTIs. Now, in the long run, my idea is okay, a lot of UTIs is okay if it goes bad enough, and eventually is okay end up affecting your kidneys. Or you can say, as okay, there may be something that the person may be suffering from that causes him or her to suffer from multiple cases of that's okay, or episodes of of UTIs, which on its own also is okay, will have its effect upon the kidneys. Okay, but multiple sclerosis is one of those conditions that we, as okay, back in the days used to say it's okay, called autoimmune. That's your own immune system that attacks your own tissues. We'll talk more about that once we get to the root word, or it's okay, prefix auto. Okay, and immune. Okay. So, and what mainly is okay, it triggers your immune system if your body needs to fight something off. Usually that's okay, what is that? Your body may need to fight off infections. Okay. So that's okay. Good is good, but then too much good is bad. I just think of it in this way. We have the police or the army or so and so. What are they there for? To protect you, right? Okay. If you call the police because you need help, and instead of helping you, the police all of a sudden say, well, okay, you're the culprit, you're the bad guy here. Okay. Okay, that's not what they were there for in the first place. You call them to help you out. So yes, okay. So likewise, that's okay if your system that is ideal is okay there to protect you turns its guns against you, you being good. Yes, okay, then that's not going to lead into something good, right? But the outcome of that would be bad. So, and whether it's due to, yes, okay, the multiple sclerosis itself, or it's okay, just the immune factors, or it's okay, a lot, it's okay, a lot, those patients most likely, it's okay, may end up with, okay, that's what you can call chronically, that's okay, recurrent UTIs, as we just refer them to as. Okay, dear. Anybody else want to say anything? Okay.
Hi.
So,
Are you able to just pull those notes back up one more time?
okay. Okay, what is the hemodialysis going to be? Yes, okay, it's just going to be, yes, okay, that's going to be the process or procedure for patients with kidney failure. Okay, where the blood actually is going to be, the blood actually is going to be, as okay, well, you can say it's okay. Are broken up in a sense mainly as okay because we need to, as okay, separate the waste material. But that's mainly as okay going to be when they hook them up to a big machine, those dialysis centers. Okay, can we go with another pad? Hemat. Okay. Okay, guys. Did you get what you needed, Maria?
Yes.
Okay, no problem. Hepat. Now again, it's okay if we need to combine vowel O. But hepat means liver. Okay. Now our first and most common term would be, sorry, hepat, itis. Okay. Now here is okay, this itis can either be inflammation or it can be as okay infection.